Hello everyone, welcome to Here to Learn, and today we will discuss on the topic major mental health crisis looming from coronavirus pandemic. The coronavirus outbreak risks sparking a major global mental health crisis, the United Nations warned on Thursday, calling for urgent action to address the psychological suffering brought on by the pandemic. While protecting physical health has been the main concern over the first month of the crisis, it is also placing huge mental strain on large swath of the global population, the UN said in policy brief. The UN brief highlighted the mental strain on people fearing that they or loved ones will be infected or die from the novel coronavirus, which has killed nearly 3 lakh people worldwide since it first emerged in China late last year. It also pointed to the psychological impact on vast number of people who have lost or at risk of losing their livelihoods, have been separated from loved ones, or have suffered under drastic lockdown orders. Healthcare workers and first responders operating under tremendous stress are particularly vulnerable, Castile said, pointing to news reports indicating rises in suicide among medical workers. A whole host of other groups also face particular psychological challenges brought on by the crisis. Children being kept out of school, for instance, face uncertainty and anxiety. Along with women, they also face a heightened risk of domestic abuse as people spend lengthy amount of time cooped up at home. The elderly and people with pre-existing condition who are considered particularly at risk from the virus meanwhile face increased stress over the threat of infection, and people with pre-existing psychological issue could see them worse, while accessing their usual treatment and face-to-face therapy may no longer be possible. One study conducted in Amhara region of Ethiopia showed that 33% of the population were suffering from depression-linked symptoms, a threefold increase from before the pandemic. Other studies indicate that mental distress prevalence amid the crisis was as high as 60% in Iran and 45% in the United States. The UN brief stressed the need for countries to include access to psychological support and emergency mental care in all aspects of their response to the pandemic. It called for a significant hike in investment in this area, pointing out that before the crisis, countries on average dedicated only 2% of their public health budget to mental health support. With this, I end the video. Thank you for listening.